My name is Lori Bumbaco. I'm a registered dietitian, and I'm also board certified as a specialist in oncology nutrition. And what that allows me to do is to pursue my passion, and that's to work with individuals all across the cancer care continuum, anyone who has been affected by a cancer or a diagnosis of cancer, how to help understand how to nourish their body no matter what stage they are in their journey. And really, I would like to give specific advice, not cookie cutter advice. And that's exactly what an oncology dietitian like myself can do. And I'm so excited to be able to be a part of this nutrition series. We're in our 4th week already. We have 6 weeks total, and we're in our 4th week. Wow. So if you've tuned in live before, thank you so much for participating. But you can also check out the recordings on the YouTube channel. And I gave already 3 videos where what I've done is I've tried to answer a common question or a common concern that someone who has been diagnosed with a kidney cancer might ask an oncology dietitian like myself. And along with that question, what most importantly are some simple yet effective solutions so that he or she can stay as well nourished as possible and help really minimize the damaging effects of that side effect. So why is that so important? Why does nutrition matter for anyone who's been diagnosed with kidney cancer? Well, we know it's critical, and I serve a very important role on the interdisciplinary team to help individuals understand how they can choose specific choices so that they can optimize their nutritional well-being. They can choose specific choices that contain cancer fighters, so really to help delay the initiation, the promotion, and the progression of cancer. There are actually compounds in foods that can do this. Wow. Also, some foods that we choose can help support our immune function, and that's especially relevant for anyone who is on active treatment. We also know that specific choices can help someone sustain their weight, and most importantly, their muscle and their muscle strength. And that's important for their immune function as well. But when you maintain muscle strength, you really are maintaining a whole body that is not conducive to the cancer process and is going to receive the treatment even better. Also, nutrition has a role in aiding in the recovery from treatment. So whether it be chemotherapy, immunotherapy, radiation, or surgery, or a combination of all those things, we know that nutrition matters. It's a critical component of cancer care. Now, as I'm giving these questions and solutions week by week, I do want to point out they are just generalized advice. And really what you deserve is specific advice tailored to you and your unique circumstances. So if you have any questions or concerns about your nutrition, please consult with your healthcare provider because you deserve personalized advice. Now, if I were on your team and working with you, I would give you that. But don't replace this generalized advice that I'm giving you with anything that your healthcare team suggests for you. Now, we are in our 4th week, as I mentioned, and I want to talk about a very common phenomenon that occurs for individuals diagnosed with cancer. In fact, it's so common, it occurs in 80% of individuals at any point in time during their cancer treatment. 80% of individuals. So I think that is a little deserving of some attention, right? So what is this common phenomenon? Well, the question that I would encourage you to ask, if this is something you're experiencing, ask your healthcare team. What can I do if I am experiencing taste changes? Did you know that taste changes occur in 80% of individuals during their cancer treatment? That's pretty significant. And the taste changes that occur really are all across the board, all over the map. And they probably are a consequence of the chemotherapy, but they also can be a consequence of certain prescription drugs. So some of the chemotherapies that we use in cancer treatment, what they do is they specifically attack our rapidly dividing cells. So it just so happens that the cells that are in our taste buds, they're rapidly dividing. And so as they are being attacked essentially by the chemotherapy, and only certain types of chemotherapies, they need to regenerate. And as they're regenerating, they're sort of immature and they're not familiar with all these different tastes and flavors, and they may seem unfamiliar to those little developing taste buds. So taste changes can be, again, as I mentioned, all across the map. Some individuals report that things have no taste. They literally fall flat. They're kind of just bland and blah. Some individuals report the opposite side of the spectrum, that some flavors have too strong of a flavor, as if things are too sweet or too salty. And some individuals even report that things taste metallic or acidic or even sour. So they say things have a bad taste. Now that's a concern, right? Because guess what? Most of us eat. The reason why we eat is because we like the way it tastes. That's why we eat. So if something doesn't taste right or taste off or even taste bad, then why would we eat, right? And so some individuals that I work with, they report that they're eating less. They're so frustrated because food just isn't the same for them. And that's a concern, because if they're not eating as much as they used to, are they eating enough? Are they satisfying their nutrition requirements? Are they potentially losing weight as a result of their taste changes? So if you suspect that that might be happening for you, please consult with your healthcare team so that can be evaluated. So the good news, right? I gave you some bad news here, but there's good news. The good news is that it's a phenomenon that's expected to be only temporary. So this is not expected to be a permanent thing. And really, the resolution comes when the underlying cause is stopped, right? So once chemotherapy is completed, many times it's just a matter of a couple months before taste is really officially back to where it belongs. But in the meantime, I would say that, you shouldn't have to suffer, and that there actually are some solutions so that you can enjoy the flavor of food, and probably just as importantly, make sure you're adequately nourishing your body, right, with the fuel that it so desperately requires, especially during the precious time of treatment and recovery from treatment. So I want to go over some simple solutions. And first, I just want to give some general tips for what you could do regardless of your taste change. The first one is to take good care of your mouth. So we call that mouth care. And what we know is that a healthy mouth is a happy mouth, right? And think about it. If you're taking good care of your mouth, you're minimizing risk for infection, but then you're also helping to kind of clear your palate so things will taste the way that they're supposed to. And one of the easiest ways to help yourself do that is to make a rinse that's mild, but will help keep your mouth healthy and happy, as well as refreshed. So it's a great idea to think about using a mouth rinse prior to eating to sort of set the stage for a happy, healthy meal. So here's this simple recipe, and I like to use mason jars a lot. They're so versatile for lots of different things. But in this mason jar, I'm going to add about 4 cups of water, and then to that, I'm going to add a teaspoon of baking soda, and then 3/4 a teaspoon of salt. Now, you could omit the salt if your mouth is sore, or you have some mouth sores, or your mouth is even tender and it's too much for you. You can take the salt out of this recipe and just use the baking soda and the water. That's enough of a cleanser to keep your mouth healthy and happy. So what I do is I just add it to this mason jar, and voila, you can give it a good shake. You have your concoction right here. So this rinsed, and you don't want to swallow this recipe, okay? You're going to just rinse, so you swish and spit what's in here. You can even gargle with this solution, but you're going to swish this around in your mouth for about 30 seconds to about a minute. You take a tablespoon at a time, and do this before eating. It's a great way to kind of, again, cleanse your palate and help you refresh so that you're starting off on a good slate. Now, if you don't get through this whole mix in a day, I want you to toss this, right, and make a fresh batch the next day. But it's a great, simple way for you to keep your mouth healthy and happy and really help to improve some of those taste changes. The next tip I want you to think about is what really I find is the most effective way to address this taste change phenomenon. And that is to make a list of what actually does taste good or does taste right, like is accurate. Like yes, I ate that and it tasted the way it was supposed to. Now what happens is there may only be 1, 2, 3 things on that list, but we can use that list and we could apply the properties of that list to other foods so that you can incorporate a greater variety and make sure you balance out your meals and make sure you're adequately nourishing your body. So here's an example of that. Let's say you were going about your day and you decided to get some lemonade, and you find that the lemonade, maybe it was fresh squeezed, fresh homemade lemonade with a lot of great fresh lemon, and you found that that tasted good. Voila, bingo, we've got one. We're going to use that, right? So now we can capitalize on that lemon, and how can we use lemon in a variety of different ways in a ton of different recipes, because this lemon will be what really stimulate your taste buds and help you enjoy a more balanced meal. So for example, if you had some chicken, but the chicken was just blah, or actually didn't taste right or tasted bad, but you used some lemon, whether it be in the marinade or a fresh squeeze of lemon at the finish of the dish, or the lemons were used in cooking the dish. Think about like chicken piccata, lots of lemons in that recipe, right? Now you've used that great lemon to help you enjoy a quality protein and better meet your nutrition goals. The last tip I have is for you to think about how to troubleshoot what else might be competing with your sense of taste. So could it be that you have an off sense of smell? Because we know that sense of smell and sense of taste are intimately involved. And is it your sense of smell that's throwing off your sense of taste? So if you're finding that that's the case for you, we can take advantage of that too. What we know you can do is, rather than having cooked meals that have an odor, you would have cool or room temperature foods. So same thing goes with that chicken. You might enjoy that chicken that's been baked last night. You might enjoy it the next day when it's pulled out of the fridge and cubed and served at room temperature. You may also want to think about eating in a well-ventilated area, right? Eat outside. What a great idea this time of year. Or even think about ways to shorten the cooking time. So for example, if you're somebody that might like to use a slow cooker, well, that odor sort of disseminates through the entire house, right? And if you are smelling that all day long, you may not want to eat your dinner. So think about maybe taking the cooking methods down to slower, shortened cooking methods, or even taking it outside. It's still grilling season, right? So it might be a way to help you minimize that odor, but maximize your ability to eat more at your meals. Now, what about some suggestions for specific taste alterations that might make sense for you? So the first I want to talk about is if you have sort of a blah taste, like things are not tasting the way they're supposed to. You know, they just are off. You know, they don't have a flavor, they're bland. That would be sort of boring, right? So what we want to do is experiment here. We want to experiment with new to you flavors, new to you ingredients, and be open-minded about that, right? So think about flavors that have a real pop or real zing and really stimulate those taste buds. It may be some things that you've never enjoyed before. For example, we're going to look at the spice rack. Oh my gosh, how many choices are in our spice rack, right? And we hardly use them, right? So the sky's the limit. I mean, things like ginger or cardamom or cinnamon, like the perennial favorite. I even have some cinnamon sticks here, but there's cumin. Oh my gosh, I can't even stop. There's so many. You can go the opposite profile. You can go with thyme and oregano and basil. The sky is the limit with options. I like fresh herbs as well, like mint, or I always have mint at home, or dill. So delicious and really a nice pop of flavor. And I also like an all-purpose seasoning. So this has, there's like 15 different seasonings in here. So guaranteed one of these will work in terms of zinging your taste buds. And so a great way to give yourself some flavor, but I think more importantly, some good nutrition in terms of your recipes. Another good example of giving you zing besides spices and herbs are vinegars. So vinegars, just a little splash of the vinegar, and there's so many different types, right? I have rice vinegar here. I have a flavored balsamic, there's apple cider vinegar, red wine vinegar. Use your pantry. Start to dig out those vinegars and give yourself a pop of flavor. They will work almost on any dish and really work to elevate the flavor. So think about using it at the dinner table or just at the table at any meal and really giving yourself a pop of flavor. I want to go back to my citrus. So lemon and lime, again, a little squeeze of this goes a long way. And finishing a dish with either of these will really help to heighten flavor and give you some great bang for buck in terms of potency of flavor. The other suggestion I have is for some pickled vegetables. So I have this big old jug in the fridge here. I pickled these a few weeks ago, and gosh, like think about how it has such a distinct flavor. And partnering some of your foods with alongside these will be a great way to again give you some pop when you're eating. So think if you had like a sandwich, with some of these pickled vegetables alongside are going to help you eat that sandwich that much better. I also know individuals that will partner things like pickles or pickled vegetables with almost anything. So they'll almost always carry around that to eat with whatever they have, and they'll alternate bites. So they'll take a bite of something, eat a bite of their pickles. And it really works, and it helps them carry through the meal. Now, what about if somebody has a bitter or a sour or a metallic taste? That can be really troublesome, right? So most often individuals that experience that type of a taste change, it's usually because of the meats that they're eating. The meat, whether it be chicken or red meat, it just tastes metallic. So what we want to do is there's actually a few solutions for this. What we want to do is we want to partner those meats, if we still want to eat the meat, with something sweet. So a great example is watermelon. I can't wait to eat this later. Great in-season fruit right now. It tastes so delicious. Or things like pineapple or kiwi. I have mango here. I can't wait to get into. This partnered with meat will help reduce the metallic taste that you're going to get from that. So again, if you cut up some cooked chicken and mix it in with some fruit and made yourself a nice chicken salad, it would help you eat that chicken that much better and give you that precious protein that you need. Now you can also think about marinades for your meat. So things like teriyaki or a sweet and sour marinade. Again, it's going to totally change that flavor profile for you. Another idea for you, if you want to step aside from meat, is to use things like meat alternatives, so our plant proteins. And gosh, again, the sky's the limit there. So I think every week that I've had a discussion, I bring up tofu. It's one of my favorite plant proteins because of how versatile it is and how literally it's a blank slate. So whatever flavor is working for you, you can apply it to this tofu, and bingo. You now are able to enjoy a cancer protective food that gives you a ton of protein at the same time. It's a winner. But also two other plant proteins are beans and also nut butters. And I find a lot of individuals that I work with, they tend to find that eggs work really well for them. And I know I brought up eggs in the past for how great of a protein source eggs are. So those are some examples of some solutions for when you might be experiencing some taste changes. I want you to think about experimenting, okay? Because you as an individual, you're unique. And you're going to find if you experiment and keep an open mind, you can empower yourself to find the right choices that will be nourishing for you. Thank you so much for watching. Please drop some comments if you have some additional questions, because I have 2 more weeks to present to you, and I'd love to answer any additional questions that you might have. Thank you so much for watching. I'll see you next time. Have a good one. Bye.